I've got the truly remarkable task today to talk a little bit about the MOU that's going to be signed, and I'm super excited because this represents quite a few years of work between a number of people. So let's get started. Today an MOU is being signed between Mark Elliott from the Chartered Institute of Environmental Health and Melissa Byrne, the President of Environmental Health Australia. How did we get to this point? So a bunch of academics, and you might have seen that those of you who came to the International Conference in Perth might have seen our Breakfast Club present some stuff. So there's a bunch of academics that get together across the world every fortnight for exactly 40 minutes. We get cut off after 40 minutes and we chat about the things that we teach, the troubles that we face, the universities, how much they stuff, all those sorts of things. But in the interim, we also write papers, co-develop resources and so on. And one of the things that happened as we were co-developing some of the teaching resources is that we recognised that there were things that were super similar about the kind of things we were delivering. So what we decided to do was develop a formal process so that we could write a Memorandum of Understanding between different countries in order to capture that similarity. And of course, because we're academics, we publish it, that's what you do. And then we went ahead and trialled it with the Chartered Institute of Environmental Health. And essentially what we did was we took the UK Professional Standards Framework, or version 1.4, and we compared it with all of the things that we have in our skills and knowledge framework that we use for accreditation. So this is a small portion of the table, and I don't expect you to read it all today, but obviously at some stage we want to read it because it's very interesting. But essentially what we found was that there were very few gaps, and that those gaps in competencies or skills or knowledge or understanding are reasonably easily filled. So yeah, we identified those things that were gaps, we worked out how to fill them, and we've included in the MOU how those gaps can actually be filled. So that essentially led to today. Today we're going to sign a Memorandum of Understanding between the two professional bodies that essentially says that if somebody wants to practice in the UK, there's a couple of things they have to do. If someone from the UK wants to practice in Australia, there's a couple of things they can do. But the key point here is that those couple of things that they have to do are very, very clear. And that was one of the problems before. People would arrive in the UK and they wouldn't know exactly what to do. People would arrive in Australia and the pathway wasn't crystal clear. And I think that's sort of the beauty here, is the clarity of exactly what people need to do in order to practice in each other's countries. So, what does this mean? Now I'm going to have to stand back and read some of this because it's quite wordy, because this is the document that we put together to ask the professional bodies to look at what we've done. So, the great Dr Dijak always talks about this their profoundly local practice that EHOs do, and that's absolutely true. But what this recognises is that that really local practice is actually really global in how it's informed. So what we do is very, very similar to what's being done all around the world. And what underpins that, the risk assessment, the capacity to understand regulation, legislation, the capacity to be pragmatic. You don't close down, the only supermarket in a remote village. So all of these things that EHOs do, they do all around the world. And I think this recognises that. So it really raises that to that global level. It enhances the environmental health qualification, so it gives us more opportunities around what you might do with your qualification. Like I said, it provides a really crystal clear pathway for professionals who want to practice in a different country. The big thing for me is this provides a blueprint now for other countries to follow. And as I said, you get people interested, the two professional bodies interested, you then map out those competencies, you identify the gaps, and then you identify how you're going to fill them. Then you create your MOU. So it's very, very clear about how two other countries might do this. So this isn't necessarily just Australia and another country. Other countries might now use our very clear process in order to create MOUs between them. It provides an advertising selling point, and we were just talking about the lack of EHOs. If we say to an EHO, you can now go and practice in Northern Ireland, your qualifications are valid there, this really enhances that. So for those of you who don't want to move to the UK, and maybe there's some people who might not, the additional thing is This gives you the potential to for Chartered Institute of Environmental Health registration, and then also the potential for that chartered status. Now the CIEH is very prestigious. It's been around about 50 years longer than EHA. I thought it was longer. Then when I googled it, it's actually not all that much longer, but it is very prestigious. So even if you don't ever intend to go to the UK, you can now undertake those professional development activities that have been identified as lacking in our qualifications by the CIEH, and then you can begin that process of registration and chartered status. So it has that potential to give you something that you might want to do just for your own professional development. So, heaps of people to thank. All the people in my breakfast club, and I won't list all of those, and then a bunch of people from the CIEH. I should specifically point out Graham Mitchell and Zena Lynch from 2 universities in the UK who worked really hard with me to actually draw up that mapping exercise. So now I invite Melissa to actually do the signing. Thank you.